Hi there, I am Tofunmi Oni. I'm an orthopaedic hip and knee surgeon and I work here at the Robotic Centre. This is enhanced technology using the aid of a robotic system to more accurately plan surgery for a knee replacement before, as well as improve accuracy during the operation in order to achieve higher results for patients at the end of the day. Well, they both have the same aim, which is to change the surfaces of the worn-out knee for a combination of metal and plastic. However, a robotic knee replacement uses additional information through a computer to specifically map a patient's anatomy with the aim of increasing accuracy and also potential to simulate different scenarios and pick a scenario that would give the patient the best possible outcome. One thing is the increased accuracy during the operation often will lead to patients recovering at a much quicker rate initially, but also getting much higher outcomes for a longer period. The simple answer is yes. Personally, I would use this technology in all my patients if I was able.